The top stories tonight in Y News. The Overseas Workers Welfare Administration, or OWWA, says that the current funds allocated for the repatriation of overseas Filipino workers will last only until next month.
The Food and Drug Administration is exploring possibilities to expand the list of drugs approved for emergency use for COVID-19 treatment.
Several senators are pushing to defund the National Anti-Communist Task Force amid red tagging issues. Indonesia deploys warships in the search for a Navy submarine that went missing with 53 crew aboard off the coast of Bali.
Couple in Taiwan got married 4 times, divorced 3 times in just over a month to enjoy the benefits of marriage leave.
And a railway worker in India saves a child from collision with a train. Good evening, Philippines and the world. We are now reporting live from EDSA Centris in Quezon City. Today is Thursday, April 22, 2021. I am Herlene Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news. The Overseas Workers Welfare Administration, or OWWA, seeks additional budget to cover the expenses of returning overseas Filipino workers as they warned funds are nearly depleted. Meanwhile, President Rodrigo Duterte expressed apprehension over a proposal to shorten the mandated 14-day quarantine period for returning OFWs. Nel Maribohok will tell us why.
Jim Edades, a seaman, shared his experience during their stay in a hotel as part of the quarantine policy of the government for the returning overseas Filipino workers. According to Jim, he stayed there for 23 days, longer from the required 14-day quarantine period.
Boredom ang kalaban namin kasi hindi kami makalabas. Yung pagkain ilalagay lang sa pintuan nakabalot sa cellophane. Hindi styro but cellophane. Kanin, ulam, and dessert. Tapos 1.5 liters na tubig every meal. So okay naman, kaya lang yung boredom lang talaga, walang bintana, yung facility, hindi ka makalabas for 23 days.
He said they understood the Overseas Workers Welfare Administration situation as the agency may have shortage in their budget. According to OWWA Administrator Hans Leo Kakdak, the 6.2 billion peso budget for its assistance to returning overseas Filipino workers will be depleted by May, and the agency seeks 9.8 billion peso supplemental budget.
Itong budget natin na 6.2 billion, nakikita natin na mauubos ng gitna ng Mayo. Una sa DBM tayo nagmamakaawa, nagsumamo. And then pangalawa yung sa Senado at saka sa House, no? Sumulat din si Sec Delio kay Speaker Velasco at kay Senate President Soto. So far may suporta naman tayo ng mga kongresista.
According to Kakdak, the average expenses per OFW is around 15 to 17,000 pesos. These include accommodations, transport, and food. The OWWA chief said the Interagency Task Force on COVID-19 should look into possible adjustments on quarantine protocol of OFWs if the government will fail to get an additional budget.
Lalabas na wala tayong maibabayad sa food, hotel, transport nila. So kailangan sigurong pag-isipan yung quarantine protocols. Baka kailangan baguhin kasi sa ganung aspeto ay hindi siya sustainable.
During President Rodrigo Duterte's meeting in Malacanang last night, Labor Secretary Silvestre Bello III asked the President to shorten the 14-day quarantine period as they are now nearing budget shortage and OFWs are complaining about their situations in quarantine facilities. President Duterte said he will still look into the proposal since he is not willing to compromise or relax the protocols.
I am not ready for a compromise about lalo na ngayon. Yung ibang sakit siguro, pwede pa yung mga rabies dyan. Pero ito, talagang, as you have said, it's dapo dito, dapo doon. And then you have the exponential problem now.
Budget Secretary Wendell Avisado has yet to comment in the issue, but Malacanang said DBM will look for other funds.
Pero ang sabi naman ni Sec Wendell, kung talagang kinakailangan gastusan yan, hahanapan at hahanapan po yan ng pondo.
OWWA expects the return of 80 to 100,000 pandemic-affected OFWs this year. Nel Maribuhok, UNTV News and Rescue, we serve the people, we give glory to God.
Vaccine czar Carlito Galvez says the Philippines may see a significant decrease of COVID-19 cases in the fourth quarter of 2021. Rosalie Cons will tell us why.
Due to massive vaccinations, the percentage of people testing positive for COVID-19 in the United Kingdom has decreased, while in the United States of America, emergency department visits and hospitalizations among people ages 65 years old and older have also decreased. But in the Philippines, vaccine czar Carlito Galvez said significant decrease of COVID-19 cases may be expected in the fourth quarter of this year when bulk of vaccine supplies are already available.
Nakikita natin pagka once na nabakunahan natin majority ng mga affected na tinatawag natin na highly urbanized cities like Metro Manila, pagka nakuha natin yan, nakikita natin na siguro by October or November nakikita natin yung epekto niya talaga na talagang pababa talaga yung kaso niya.
According to the official, the country has an average of 50 to 60,000 individuals being inoculated every day. In June, we are expecting million doses of vaccines. Massive vaccinations of priority group A4 or economic frontliners and A5 or the indigent population will be undertaken. In Metro Manila alone, the government eyes more than 100,000 vaccinations every day by that time.
Pagka nandito na po ang vaccine this coming June, magkakaroon po tayo ng average na dito pa lang sa NCR na 120,000. Pero dapat kailangan meron tayong bastante na 3.3 million na vaccine per month.
But currently, without enough vaccine supply, the government continuously appeals to the public for the maximum observance of the minimum health protocols against COVID-19. Rosalie Cos, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the Food and Drug Administration is looking into adding more drugs that it would allow for emergency use on COVID-19 cases. Ray Pelayo reports why.
Deputy Speaker and Bagong Henerasyon Party List Representative Bernadette Herrera D. sees the urgency of having the availability of drug to treat COVID-19. During the hearing of the House Committee on Good Government and Public Accountability, the lawmaker asked the Food and Drug Administration, or FDA, if it is possible to expedite their approval procedure. The FDA said that it will only take 24 to 48 hours for them to approve the application of a drug product under emergency use or DEU. The House leader told the FDA to include inputs from the concerned doctors and citizens of the Philippines, a group that has been advocating for ivermectin.
Ang akin lang pinapadali ko lang kasi ang pagpasok ng drugs dito sa ating bansa. Total, hindi naman porkit nasa DEU yan, ay gagamitin lahat yan, di ba? It still depends on the doctor kung ano ang i-recommenda niya depending on the need of the patient.
Pwede po naman natin tingnan kung paano i-expand yung DEU. As of now, in-expand po natin siya to the living guidelines na maraming grupo ang kasama. And I hope that more groups will be able to join it.
The FDA has issued almost 2,000 Compassionate Special Permit or CSP for COVID-19 drugs. A doctor or a hospital may apply for CSP if they want to use a drug not registered in the country.
We are not anti-ivermectin, no? Just to be clear. Ang FDA po anti lang kami dun sa mga unregulated, unregistered.
Ray Pelayo, UNTV News and Rescue. We serve the people. We give glory to God.
The Philippines registered 8,767 new cases of novel coronavirus disease, pushing the total tally to 971,049. In its 4 p.m. bulletin, the Department of Health said the latest tally brought the country's active cases to 107,988. The tally does not include data from one laboratory that failed to submit their reports on time. The DOH also reported that the total recoveries climbed to 846,691 after 17,138 more patients recovered from the disease. The death toll, however, rose to 16,370 with 105 new fatalities.
A group of nurses believe that the working condition of healthcare workers in the country has worsened. That is why they are urging the government to act urgently to support the country's medical frontliners in the waging war against COVID-19. Arlene Delgado reports.
This photo of 2 nurse attendants in Pampanga went viral as they take a rest with their full PPE on. According to Dr. Katie Magsino Santiago, the author of the post, the photo of nurses Ronnie and Giselle was taken at 1 o'clock in the morning after working for an entire day. She calls them the unsung heroes who give the best of their efforts despite the low wages. For the Filipino Nurses United, or FNU, the country's healthcare workers have been neglected. The group's president, Maristela Presto Abenojar, says many health workers are working beyond their shifts. She adds some hospitals reported that their nurses have too much patient load, ranging from 12 to 20 COVID-19 patients per nurse. Based on the health department's tally, more than 17,000 healthcare workers in the country have contracted COVID-19.
Dapat po ay isang nurse mayroon lamang 3 pasyenteng COVID. Dahil itong ating mga pasyente ay walang kasamang bantay o mga kamag-anak. Lahat ay gagawin ng ating mga nurses para sa kanila. Sila po ay nawawala na ng pag-asa at matindi na po ang kanilang pagod. 1 taon na tayo pero parang hindi natuto.
Some private hospitals are also facing the same problem. Private Hospitals Association of the Philippines Incorporated, or PAPI President Dr. Jose de Grano, says many health workers in private hospitals have left to work in government facilities and abroad.
So halimbawa, dati po ay 120 ang nurses namin, ngayon po 80 na lang, 80 na lang. So yung pong iba, mas lalo na, yung iba pang maliliit na hospitals, ganun din. Yun po ang nagiging problem nila right now.
Although they are adapting, De Grano is willing to work with the government should they be given augmentation from other provinces. The FNU is urging the health department to start mass hiring of health workers and to immediately release their long overdue compensation, such as the active hazard duty pay and special risk allowance.
Ang liit-liit na nga lang po ng nakalaan para sa ating mga health workers kagaya ng mga nurses, pero delayed pa. Yun pong mula September 15 hanggang December 19, 2020, tinanggap lamang po ng ating mga health workers March na, ang iba ay April 2021.
On Monday, the group met with Health Secretary Francisco Duque III for a dialogue. There, according to Abenojar, Duque said he wrote to the Department of Budget and Management for a 16 billion peso fund for the benefits of health workers from December last year up to this year.
The Secretary of Health also committed that he will be scheduling a meeting with the DBM Secretary, Secretary Avisado, para mas maipaliwanag po sa ating mga alliance ng healthcare workers yung ukol dun sa mga katanungan nila when it comes to their benefits, yung kanilang mga plantilla positions.
FNU hopes that the Secretary of Health will be true to his word and that the government will act with urgency in giving support and protection to the country's health workers. Arlene Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
For those watching our 24/7 live streaming on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook. The Kilusang Mayo Uno or KMU admitted to distributing pamphlet materials to residents in their community pantry in Quezon City. Dante Amento reports why.
Kilusang Mayo Uno or KMU Secretary General Jerome Adonis says they just want to stress their call to the government on the pamphlet materials they are distributing in their community pantry. This includes mass testing, free vaccines, assistance for the pandemic-affected residents, and to stop the red tagging. Adonis adds, KMU has no hidden agenda because they have been doing this for several years.
Bakit kailangan manawagan kayo? Tama na, sobra na, patalsikin na. No? Again, uulitin ko, ito po ay naging demands ng mga manggagawa at mamamayan bago pa ang mga community pantries na to.
KMU also asks the residents to sign a petition for the appeal of 10,000 peso monthly financial assistance for those who have lost their jobs and most vulnerable sectors. But Adonis explains this is not compulsory. The progressive group denies that they are taking advantage of the initiative to encourage people or create hate campaign against the government.
Hindi po totoo na ginagamit namin yung community pantry. Inadapt namin yung community pantry dahil initiative ito ng mga ordinaryong kababayan natin, mga kapitbahay.
Meanwhile, the community pantries in Barangay UP Village and Barangay Central Quezon City have no requirements to get products except from strict compliance of health protocols.
Wala naman po. Pumila lang po ako. Opo. Basta naka-face shield, naka-face mask.
Dito po wala pong rekisito. Basta ang pinapalaganap nga namin na prinsipyo ay yung magbigay ayon sa kakayanan at kumuha batay sa pangangailangan.
But the organizers admit they are worried of their security or be among those who will be red tagged.
Sana po kami rin po ay mapangalagaan yung seguridad namin, yung security namin kasi takot nandun pa rin yung pangamba na yun nga, tatargetan tayo kahit wala tayong ginagawa.
The AFP, on the other hand, assures that they will provide security assistance if necessary. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
The Armed Forces of the Philippines have expressed support for the community pantries and laid out their ways to help the voluntary aid work. However, pantry organizers were called on to be sincere and faithful in alleviating hunger. Leah Ilagan reports why.
The Armed Forces of the Philippines will support the distribution of free food in the community pantries across the country. AFP Chief of Staff General Cirilito Subihana says they fully support all humanitarian efforts from all the sectors, especially amid the pandemic, where most families lost their source of income due to the imposition of community lockdowns.
Some of the sectors of our society are locked down. They could not earn for a living. For those who are yung tinatawag nating 1D, 1/8. Pag hindi sila nakalabas upang maghanap buhay, tiyak hindi nila mapapakain yung kanilang pamilya at ang kanilang kasamahan sa bahay. Kaya itong gesture ng pagpapakain sa ating mga kapatid na masasabi nating less fortunate ay isang humanitarian action which your armed forces being the protector of the people ay sumusuporta nito.
Subihana said he has ordered the civil-military operations to organize humanitarian activities similar to the community pantry.
Yes, yung existing community pantries, susuportahan natin. Yung areas na wala pa, gagawa tayo ng similar activity.
Subihana also appeals to the organizers of the community pantry to be sincere in alleviating hunger instead of using their work to promote their anti-government propaganda.
Tinitingnan natin, ina-evaluate natin, binabalidate natin kung bakit nagkaroon ng ganong klaseng pamphlet. Samantalang ang activity naman ay ang pakay ay pagtulong sa ating mga kababayan na nangangailangan. So sana, pag gumawa tayo ng humanitarian na efforts, wag na nating haluan ng personal greed or divisive agenda.
Meanwhile, Subihana refused to comment directly on Lieutenant General Antonio Parlade's pronouncements on some community pantries linked to communist groups. Leia Ilagan, UNTV, News and Rescue. We serve the people. We give glory to God.
Several senators want to defund the government's anti-insurgency task force amid the alleged red tagging of organizers of community pantries. But its spokesperson, Lieutenant General Antonio Parlades, says the senators should not drag the entire task force if they have problems with him. Arlene Delgado will tell us why.
A waste of people's money. This was how Senator Joel Villanueva expressed his disbelief following the alleged red tagging of the National Task Force to End Local Communist Armed Conflict, or NTF-LCAC. This comes after its spokesman, Lieutenant General Antonio Parlade Jr., made a controversial remark against Ana Patricia Non, the organizer of the Maginhawa Community Pantry. Villanueva says he wants to defund the task force, noting that its 19 billion peso budget should be reallocated for financial aid to families. Other senators, including Sherwin Gatchalian and Kiko Pangilinan, also supported this. Meanwhile, for Senate Minority Leader Franklin Drilon, President Duterte should now realign the budget. Senator Risa Hontiveros also supported the move and renewed her call to abolish the task force. Senator Panfilo Lacson, meanwhile, is now uncertain in defending its budget next year, as he recalled how the Defense Department ignored the Senate's recommendation to remove Parlade as the NTF-LCAC spokesperson. But for Senate President Vicente Soto III, it is better to replace the officials than defunding the task force, which he believes is a good program. In a tweet, Parlade says if the senators have a problem with him, they should not drag the entire task force. According to Parlade, defunding NTF-LCAC would mean taking back the development funds for communities. The palace, meanwhile, opposed the proposal.
Ang pagkakaalam ko po, yung pondo ng LCAC para po sa mga proyekto na magbibigay ng asenso at progreso sa mga lugar na meron pang mga rebelde. So sa akin po, hindi naman po justified yan. No? Hayaan natin gawin nila ang katungkulan nila kung meron talaga silang opisyal na ginagawa dyan, pero ang pulisiya po ay malinaw.
Arlene Delgado, UNTV News and Rescue. We serve the people. We give glory to God.
Organizers of the Maginhawa Community Pantry are now planning to relocate to a different location in Quezon City as people continue to flock to the area. JP Nunez will tell us why.
The homeowners at Teachers Village in Quezon City has requested to the organizers of the Maginhawa Community Pantry to transfer to a different location. This as more people continue to visit the venue and resulted to overcrowding in the area. The homeowners said that this may be cause for COVID-19 to spread. The community pantry has been closed this afternoon as the Quezon City LGU representatives calls on organizers for a closed-door conference.
So may tinitignan tayong mas malaking location, mas safe para rin hindi ma-produce yung homeowners natin. So yan, pero pina-finalize pa yung venue and inaasikaso pa namin.
The Quezon City local government assures they will help relocating the community pantry. The update will soon be announced by Patricia on her Facebook page. Meanwhile, members of the Armed Forces of the Philippines brought sacks of vegetables in the pantry this morning. JP Nunez, UNTV, News and Rescue. We serve the people. We give glory to God.
The Maginhawa Community Pantry received outpouring cash and in-kind donations from different people and places. However, its organizer defends their call for cash donations abroad. Asher Kadapan Jr. explains why live. Asher, go ahead.
Diego Ana Patricia Non refutes the statement of Presidential Communications Operations Office Undersecretary Lorraine Marie Badoy in her social media account, where the latter questions the donation drive for the Maginhawa Community Pantry for international donors. The organizer of the said community pantry refers to the statement as baseless and superficial. Non explains that she was only driven to call for donations from abroad due to the initiatives of people overseas.
Madami na kasi nag-aas ng donation po na galing sa ibang bansa. Sabi ko sa mga kapatid ko, busy na ako. My sister po is based in US and siya talaga yung nag-mutual aid sa US. Doon ko rin nakuha yung idea.
Non also explains that anyone from any place may donate for the community pantry to aid the needy. The said donation drive already accounted more than its target of $10,000 or about 500,000 pesos. The outpouring support they are receiving, Non said, is due to the apparent intention of the community pantry.
Siguro po nakikita rin ng mga tao na genuine naman po yung layunin ng community pantry and kailangan siya suportahan.
The Maginhawa Pantry organizer says she is also ready to provide the accounting details of the money she received from the donations against its distribution. Diego?
Thank you, Asher Kadapan Jr., reporting live.
A year from now, the Filipino people will once again exercise their right and power to vote for the country's next leaders. For election lawyer attorney George Garcia, the government's response to the COVID-19 pandemic will be the main consideration of the voters in choosing who to vote. According to Garcia, politicians should also stop thinking that Filipino voters can be easily swayed.
Simple lang. Ano ang naging response ng pamahalaan sa pandemyang ito? Kami ba ay naging safe nung panahon na may pandemya? Yung mga ordinaryong Pilipino hindi na nila maluluko kasi ngayon mahihirapan na rin nilang basta-basta bigyan lang. Mayroong tinatawag na sweetener. Pero ang tanong, sa bandang huli, may sweetener nga, mapait pa rin yung kanilang pagdurusa. So, yun ang issue na kakaharapin at yun yung magiging sentro sa darating na halalan ng
Political analyst Professor Edmund Dayao has the same sentiment. He believes that the pandemic will be the foremost issue that will be considered by the public for the 2022 elections. However, Dayao says candidates who have more resources could still use it to their advantage.
Public has always been wise in the sense that alam mo, nagpapalit ng pamantayan ng publiko palagi, ano? Hopefully, yun na nga, medyo maging wake-up call, no, for the voters to really be more discerning in choosing who they are going to vote for. But again, as I've said, dahil nga sa sistema natin, hindi pa din natin maiaalis na yung traditional means malaki pa ding factor yan.
For his part, Garcia advises voters to choose for candidates who have a vision for the country and has a sound moral compass.
May paniniwala ba sa Diyos? Number 2, ano ang kanyang pinanggalingan? Yung bang kanyang pinanggalingan ay padami siyang natutunan na karanasan na alam niya ang nararamdaman ng ordinaryong mamamayan.
Researchers at Penn Medicine have discovered why women develop heart failure during pregnancy. Nina Bascon reports.
In Philadelphia, Penn Medicine researchers have discovered further information about genetic mutations that firmly affects the younger generation of pregnant women. Peripartum cardiomyopathy, or PPCM, is a rare medical condition that weakens the heart muscle, which begins around the final months of pregnancy that can last until 5 months after childbirth. PPCM affects women in 1 out of every 2,000 deliveries worldwide, with about a third of those women developing heart failure for life and about 5% of them dying within a few years. The reasons behind why women develop PPCM was a mystery until a 2016 study strongly suggested that some genetic mutations predispose women to the disease. The senior author of that study was Sultan P. Arani, who is a Samuel Bellet Professor of Cardiology in the Perelman School of Medicine at the University of Pennsylvania. They found that the PPCM genetic profile was similar to that was found in patients with non-ischemic dilated cardiomyopathy or DCM. This is a disease that is typically impacting middle-aged men and women and a well-known disease in the medical community. Researchers hope that this will push for changes that allows physicians to follow similar and well-established genetic testing practices and counseling guidelines which are already in place for patients with DCM and also gene-specific therapies. Nina Bascon, UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Health has allowed COVID-19 patients to isolate themselves in the comfort of their homes. But if you are a patient or a family member of an infected person, what should you do first and what are the things needed for your home quarantine? Aiko Miguel has this story.
Prevention is better than cure. This is always the reminder of health experts to public. Now that the country is facing a pandemic, they also repetitively remind the public to observe minimum public health standards, wearing of face mask and face shield, physical distancing, regular washing of hands and disinfection. But if you are already infected with the virus, you should inform your barangay health emergency response team to be guided what to do.
Ng ating local governments were instructed to monitor their constituents who are doing home quarantine or home isolation.
A patient who is in home care or isolation needs a physician to guide him. Under isolation, a patient should avoid interaction with family members. Make sure there is enough ventilation or air circulating in the room. The DOH advises the public that as one needs to be prepared when there is a typhoon, one must have thermometer to monitor body temperature. There should be an oximeter. This is to monitor if a person has enough oxygen saturation and should not be below 94%. Home care kits should include vitamin C, D, and Z to support and boost the immune system. Eat healthy foods and always hydrate. Let a medical expert know if there are changes in the way you feel.
Yun pong mga may sakit at nahihirapan ng huminga, hindi po talaga alternatibo ang bahay, no? So you will need to go to a facility kahit nasa tent lang po tayo, basta makita po tayo ng ating mga healthcare workers sa ospital.
But the DOH also warns the public to not just believe all the survival guide posted online. Avoid self-medication for it may bring more harm than good to a patient.
As for the other drugs, patulad ng mga melatonin, VCO, ivermectin, hindi pa po kumpleto ang mga ebidensya dito sa mga supplement at saka gamot na mga ito para masabi natin that we can use it at home.
But the most effective way to protect someone is through praying. Let us always ask for God's mercy and grace who keep us all safe amid the pandemic. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Concerns are growing for the crew of an Indonesian submarine that has been missing in the waters of Bali for over 24 hours. Maeve Yandog will give us the details live. Maeve?
Jago, the Indonesian Navy are currently conducting a search party for the whereabouts of a Navy submarine with 53 men on board. The KRI Nanggala 402 vessel was scheduled for a routine torpedo drill above the island of Bali, but failed to report it back and contact was lost. The German-made submarine is thought to have disappeared in waters about 60 miles off the coast of Bali early on Wednesday morning. Meanwhile, an oil spill found near where the missing submarine dived could point to fuel tank damage or could also be a signal from the crew, the Indonesian Navy said. 6 Indonesian warships are conducting a search and rescue on the missing vessel. Singapore and Malaysia have also dispatched rescue ships. Jago?
Thank you, Maeve Yandog, reporting live from Australia.
Russian police have arrested thousands of people during a day of demonstrations across the country, calling for the freedom of Kremlin's biggest critic, Alexei Navalny. Marvy Delfin will give us the details live. Yes, Marvy.
Harleen, thousands of supporters of imprisoned opposition leader Alexei Navalny took to the streets of 82 cities after Russian President Vladimir Putin delivered his annual State of the Nation address, with police detaining more than 1,400 protesters, according to a monitoring group. In his speech, Putin said Moscow would respond swiftly and harshly to moves against its interests. Some people were arrested even before the protest began, including Navalny spokeswoman Kira Yarmish and Lyubov Sobol. The OVD Info Monitoring Group also reported that police searched the offices of Navalny's organization and detained a Navalny-affiliated journalist in Khabarovsk. Navalny's team called for the unsanctioned demonstrations after reports that his health was deteriorating and his life was in danger. The 44-year-old began a hunger strike on March 31 over what he said was the refusal of prison authorities to allow his doctors to visit him for the acute leg and back pain he was experiencing. However, the penitentiary service has rebuffed the doctors' attempts and that Navalny was getting all the medical help he needed just like any normal prisoner would. On Sunday, he was transferred to a hospital in another prison for elevated levels of potassium and was given a glucose drip. UN human rights experts have called on the Russian government to allow Navalny to be medically evacuated and receive treatment abroad, but to no avail. Back to you, Harleen.
All right, Marvi, thank you for that live report. Companies in Taiwan are legally obliged to offer 8 days of paid leave to newlyweds, but a couple tried to game the system and earn from it. RK Liorca will tell us why live. Yes, RK?
Yes, Harleen. Eager to make the most of a newlyweds holiday, a Taiwanese man marries his wife 4 times and divorces 3 in 37 days to maximize paid honeymoon leave. The man worked at a bank that legally provided an 8-day paid leave for wedding plans. After his first marriage in April 2020, he and his wife filed for a divorce at the end of the initial 8 days. The next day, they wed once again and the groom requested another paid leave from work. He and his bride repeated the process until they applied for a total of 32 paid days off from work. The groom's employers tried to stop him, but he appealed to Taipei's Labor Department, which fined the bank 20,000 Taiwanese dollars for violating the leave regulations. That was because, as far as the law goes, there is currently no restriction on how often an employee can apply for marriage leave. The bank, which was only willing to offer 8 days off, said the man had abused the law. Last week, the Labor Department revoked the fine against the bank to recognize a mistake and improve. Not to be deterred, the employee, who later quit the bank, has called the Labor Department to complain that his former employer still owes him 24 days of leave. Harleen, the unusual story was confirmed by Taipei's Labor Department last Wednesday, which has been the talk in the town since last year by loophole wrangling Taiwanese citizens. Back to you, Harleen.
Thank you, RK Liorca, reporting live from Thailand.
Meanwhile, a tough decision was made by a railway worker in India to save a child from the path of an oncoming train. Early Briones will tell us why.
On Saturday, a 6-year-old boy who was in a near-death experience at the Vangani station, India, was saved by 30-year-old railway signals worker Mayur Shelke. Surveillance cameras recorded the act of bravery. The child was walking along the station with his mother, Sanjita Shersat, who is conditioned with poor vision, though suddenly her child slipped off the platform and onto the railing. The hysterical screaming of the mother alerted Shelke. At the same time as this happening, an express train was approaching, and only seconds away from danger, without hesitation, Shelke ran along the tracks to save the boy's life. For his actions of bravery and courage, Mayur Shelke was commended on social media, praised and awarded 50,000 Indian rupees from the Asian Institute of Transport Development. Early Briones, UNTV News and Rescue. We serve the people, we give glory to God.
In these trying times, the emergence of community pantries started blooming for the last several days. Along with it are stories of inspiration that went viral on social media, where less fortunate individuals proved that poverty is not a hindrance to help others in need. Marvin Callas reports.
Filipinos are inherent of being charitable, but due to the outgrowth of the current pandemic, several jobs were affected and many struggles for finances. That's why community pantries served a great help for others to get free items and survive the rest of the day. Along with these are stories of inspiration, proving that poverty is not a hindrance to serve others in need. One living proof is Lola Thelma, a 75-year-old who lives in Barangay Banago, Bacolod City. A netizen narrates that Lola Thelma came across their community pantry, asking if she could take a bag of rice and some goods. After taking some items, she decided to leave her merchandise bicho-bicho as her pantry donation, since she already has enough of her sales for the day.
Ginoo lang balo sa akon. Ako sining ko ang ginamuli ko ni. Buligan man ko gyapon sa Ginoo ko may ibang tao nga makakita sa akon nga pigado. Kung may matagid mo ko, Lord pasalamatan kung gabi may kung makatulog day. Ang may nagkasabata ko nga mo nabala na sabo nga may nagpadala sa akon. Tululo ako ya. Wahai, Ginoo lagi sa sining ko nagka. Kun ano ni piga pabati gid sa nga akon mga muyo.
Many were also moved by the story of an old man in Bacolod City, donating his merchandise to Charon in return to the pantry organizers after taking some canned goods. A wholesome act was also recognized from a lady in Pamplona, Cagayan by donating her harvested vegetables. And another act of kindness was also recognized by netizens on an ice cream vendor handing ice cream to residents at Barangay 163 in Pasay City. According to the vendor, he don't mind losing profit for a day just to see a sweet smile on others' faces.
Unang-una po yung kagalakan, hindi talaga may paliwanag. Yun yung hindi kayang bayaran ng bagay dito sa mundo eh. Yung magkaroon ka ng kapayapaan pag gumagawa ka ng mabuti.
They are just some of our countrymen, giving credit and proving that no matter how hard a situation is, the most important thing is to care for others and preserve the spirit of Bayanihan. Marvin Callas, UNTV News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news, April 22, 2021. I am Harleen Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
And because we need to know, we will always ask why. I am William Theo. We serve the people, we give glory to God.